Back in 2011, the FDA identified a possible association between breast implants and the development of anaplastic large cell lymphoma. Just last year, the FDA received a total of 450 medical reports of this. And this morning, doctors Bryan and Kara Criswell from Criswell and Criswell Plastic Surgery are here to talk about this breast implant-associated anaplastic large cell lymphoma. Yes. My goodness, it's a mouthful.
It is.
And this is something that is making the headlines right now. So give us sort of the rundown, Kara, of exactly what we're talking about, because it's actually not breast cancer, which to me is a very surprising headline.
Right. It is found, it's an anaplastic large cell lymphoma, so it's a non-solid tumor mass that develops in a fluid around an implant. So the thought is it's just related to that fluid around the implant and not a separate breast mass.
And it's only fluid around certain implants, Bryan, right? It's not, you have two different examples here so people can see the texture and the non-texture. Explain the difference and how this plays out.
So we run two of the major types of implants. One is a smooth round implant and one is a textured shape implant. And to date, no cases have been found just involving the smooth round implant. This is the most common type of implant we use for breast augmentation and even in reconstruction. The textured shape implant are the ones that's been associated with this type of lymphoma. And the texturing around this implant is helpful in some ways in that when you place a shaped implant in the body, you don't want it to turn, so the texturing acts like Velcro, so it sticks in place. But we're finding that it may do some other things and cause inflammation, and that inflammation may be a setup for this type of lymphoma.
If you're watching right now and you have one or the other types of in particular, if you have textured implants, you're probably freaking out a little bit, right? What should people do if they're thinking, could I be possibly experiencing, am I a candidate for this?
So the thought is that in the current recommendations is no additional treatment except your normal mammography.
Okay.
So unless someone develops a unilateral breast swelling, so one-sided swelling indicative of fluid developing around the implant, then that would warrant further testing and further removal of the implant, et cetera, for the treatment of the disease process.
Because the way that you test with this also, as you said, mammography is what you would typically have, but you have to test the fluid for this to have the cancer show up. Is that right?
So the recommendation is if you are having no problems, there's no reason to go see your plastic surgeon. If one breast is slightly larger than the other side, go in and see your plastic surgeon, and then we're going to need a test for the fluid.
Now, you were telling me beforehand, too, that other countries have pulled these textured implants off the market. The U.S. has yet to make that step. Do you think they're going to?
That's a big call. France has pulled it off the market right now, pending further investigation, and the FDA is actively involved with this, and so they're looking at this very closely. I think time will tell.
And the difference also is the market for the textured implants. So in the U.S., there's less than 13% of the market uses textured implants, both for reconstructive and cosmetic purposes.
And you said you haven't really seen, this is just fairly new information in terms of patients and what they're asking for. Are there any types of health risks associated with the other type of implant, the non-textured implant, that would, you kind of gotta play the balance game, right, of which one could pose bigger risks?
Well, at this point, we don't have any incidences of just a smooth implant. So if someone has a current smooth implant in and has a previous textured implantation done like 10 years ago or whatever, then you could develop that. But the smooth only, we have no documented cases of.
So far, the smooth implant is the most studied medical device in the history of the world, and we have no association with the smooth device in any type of this type of cancer.
Good information. Doctors Bryan and Kara Criswell of Criswell and Criswell Plastic Surgery, thank you so much for coming in.
Thank you.
Appreciate the time. Guys, take a quick break. Come back for more Good Day right after this.